A urinary tract infection, UTI, is an infection in any part of the urinary system. The urinary system includes the kidneys, ureters, bladder and urethra. This type of infection can involve your urethra, a condition called urethritis, kidneys, a condition called pyelonephritis, or bladder, a condition called cystitis. Most infections involve the lower urinary tract, which are the bladder and the urethra. Urinary tract infections are very common, occurring in 1 out of 5 women sometime in their lifetime. Though UTIs are common in women, they can also happen to men, older adults and children. It's common in women because the urethra, which carries urine out of the body in females, is shorter and closer to the anus, where E. coli bacteria are common. 1 to 2% of children develop urinary tract infections. Each year, 8 million to 10 million visits to doctors are for urinary tract infections. Causes: urinary tract infections are caused by microorganisms, usually bacteria that enter the urethra and bladder, causing inflammation and infection. Though a UTI most commonly happens in the urethra and bladder, bacteria can also travel up the ureters and infect your kidneys. More than 90% of bladder infection, cystitis, cases are caused by E. coli, a bacterium normally found in the intestines. Symptoms: a urinary tract infection causes the lining of the urinary tract to become red and irritated, causing inflammation, which may produce some of the following symptoms: pain in the side, abdomen or pelvic area, pressure in the lower pelvis, frequent need to urinate, urgent need to urinate, and incontinence, urine leakage. Painful urination, dysuria, and blood in the urine, the need to urinate at night, abnormal urine color, cloudy urine, and strong or foul-smelling urine. Other symptoms that may be associated with a urinary tract infection include pain during sex, penis pain, flank pain or lower back pain, fatigue, fever above 100 degrees Fahrenheit, chills, vomiting, mental changes or confusion. Diagnosis: the following tests will be carried out to diagnose your UTI. Urinalysis: this test will examine the urine for red blood cells, white blood cells, and bacteria. The number of white and red blood cells found in your urine can actually indicate an infection. Urine culture: a urine culture is used to determine the type of bacteria in the urine. This is an important test because it helps determine the appropriate treatment. If infection doesn't respond to treatment, you keep getting recurrent infections, your urinary tract might be examined for injury or disease using ultrasound, cystoscopy or CT scan. Treatment: antibiotics are typically used to treat urinary tract infections. Your healthcare provider will pick a drug that best treats the particular bacteria that's causing your infection. It's very important that you follow your healthcare provider's directions for taking the medicine. Don't stop taking the antibiotic because your symptoms go away and you start feeling better. If the infection is not treated completely with a full course of antibiotics, it can return. If you have a history of frequent urinary tract infections, you may be given a prescription for antibiotics that you would take at the first onset of symptoms. Other individuals may be given antibiotics to take every day, every other day, or after sexual intercourse to prevent the infection. To prevent frequent UTIs, it is recommended you do the following: wipe from front to back when you go to the toilet, keep the genital area clean and dry, and drink plenty of fluids, particularly water, so that you regularly pee during the day and do not feel thirsty. In addition, wash the skin around the vagina with water before and after sex, pee as soon as possible after sex, promptly change nappies or incontinence pads if they're soiled. Talk to your healthcare provider about the best treatment option for you if you have a history of frequent UTIs. Thanks for watching.